Hello, Dr. A. Welcome back to episode 7, Ingredients for a Better Life. Thank you so much for the episode last week on protein. A lot of people reached out and messaged and had no idea, for one, that they should be even looking for all those things in their blood besides their normal, cholesterol test. This week I compiled a list of questions from people calling in, and the number one question last week talking to people was, okay, look, my father's bald. I have genetic hair loss in my family. Now I'm starting to thin. Will Stop and Regrow work for me?
And the answer is yes, right, Jay? If you see hair loss in your family and your hair is starting to thin or noticeably not as thick as it used to be, and you're not sure what's going on, it makes logical sense that it's probably genetics, and the blood work will confirm or rule out genetics. So I think everyone should get the biomarker report card to either rule in a genetic cause or rule out a genetic cause. Doesn't that make sense?
Yeah, that was my next question, is how can I tell if I have that genetic hair loss in my history? So the blood test will figure that out.
Absolutely. So we've got quite a few patients that come in, Jay, and they don't know on their mother's side, or they're not sure on their father's side. And I don't ask them to dig back through their roots. At the end of the day, we've got a lot of adopted patients that are on the program. I don't need to look through your history and that 23andMe, that that nonsense test that looks into things that might happen. Things like that don't help. And all I really need to do, Jay, is get that biomarker report card, but no one else could diagnose or rule out a genetic cause if you didn't do any blood analysis. So some people, as you mentioned, are getting blood work done, but blood work done is not the full comprehensive hormone axis so that you can understand the genetic predispositions that are underlying your hormonal axis, right? That you might get some sodium, magnesium, potassium numbers, but those minerals aren't going to help you understand how the molecules in your body are being formed based on that genetic predisposition.
It seems like this affects more people as time goes on, right? I mean,
as you mentioned, Jay, we've been dealing with this condition for 2 decades, and the numbers are changing. I think it was 50% by the age of 50 would be affected by hair loss. Now 60%, 70%. We're up to 80%. And I think it's still 100% of people will be affected by the prostate growth. Both of those conditions are affected based on the ratio of the hormones inside the body. So both conditions can be cured, prevented, treated, whatever word you'd like to use. But we've got young men starting treatments at the age of 15, and we're going to follow them over the next couple of decades, and we're going to follow their prostate health as well. And Jay, what we'll probably find out is if we can improve the nutrition with young people as they become adults, and if we can improve the hormone genetic defects as they age, we're going to probably have a better quality of life throughout the course of our life, because we're actually treating our health and not waiting for a disease, which is the modern healthcare institution today.
Last week was very great. It was a really good episode, because a lot of people messaged and said, I had no idea that I can use protein to increase my immunity. I was like, well, yeah, absolutely you can. So that word is getting out there, that it's not a vaccine or something or vitamin C. It's that protein level in the blood that'll actually protect you and keep you nice and you're nice and strong, and prevent infection and disease and everything. So it's very good. So I appreciate you getting the word out. And again, as far as this week goes, we'll get it out. If anyone has any questions or comments, just drop them down, send us a message, and next week we'll have you address those, Doc. Okay, have a good holiday, and we'll see you before that, though. We'll check in with you a day before Christmas Eve. Okay.
You got it, Jay. Thank you very much, and enjoy your week.
You as well, Dr. Ray. Thanks for your time.